In this video, I'll be reacting to Dr. Huberman's video on how to stop hair loss before it's too late. And this is a clip from his full video that we'll be linking in the description below.
Today we are discussing hair. Hair is a topic that occupies the minds of many people. There are people that are losing their hair and want to halt or reverse that loss of hair. And today we will talk about all the ways that science has taught us we can slow or even reverse hair loss. What we know is that by age 50, approximately 50% of all men and women will have experienced significant enough hair loss that they start to notice it. In fact, most people who experience even marginal hair loss undergo pretty severe anxiety. Here's why. If you stress too much, it can actually make your hair fall out. For instance, one of the longest standing treatments for halting and reversing hair loss is so-called minoxidil, that increase blood flow. And that
minoxidil is not so much meant to halt hair loss. It can reverse to some degree. It really just mainly changes the dynamic between terminal and villus hair. So the villus hair are like the finer hairs that you get from the miniaturization process of hair loss. The terminal hairs are a bit more thick, are a bit longer, and so minoxidil can reverse that process to a degree. Minoxidil does not have too many anti-androgenic effects. It has maybe a very small component of that. The main agent for halting hair loss is going to be finasteride or dutasteride, but basically a 5-alpha reductase blocker.
Might increase the rates of hair growth or more likely increase maintenance of hair that one already has. Minoxidil has been shown to be effective at slowing rates of hair loss.
That effect of slowing the rate of hair loss is really a minimal type of effect for minoxidil. If you're interested in learning more about medical therapy and obtaining it, head over to feelconfident.com.
People that are starting to experience some hair loss. I should also mention that minoxidil treatment, if you pursue it, is likely something that you are going to have to do for the rest of your life if you want to hold on to the hair growth that you obtain with minoxidil, or if you want to maintain the hair that you are already maintaining with minoxidil.
So if you were to choose one medication to be on, especially as, like I say, a younger guy who's losing hair, the answer would be finasteride. Now, whether or not you decide to add minoxidil to that is really up to you. And Dr. Huberman is right in that if you do decide to be on minoxidil, you have to continue it forever to see that same impact that the minoxidil initially had.
That is an important consideration. So now I'd like to discuss the ways that one can chemically adjust certain things within the hair growth pathway in order to stimulate hair growth or halt hair loss. The first thing on this list is actually going to be pretty surprising to a number of you, and that's caffeine. By ingesting caffeine or by applying topical caffeine ointment or cream to the scalp.
In the shampoo, conditioner, and thickening foam that we formulated, we've included caffeine for the reasons that I think he's about to go into. Those products will be available at feelconfident.com at the end of 2023. And if you want to stay updated on the products as they're being developed, make sure to sign up for our listserv.
So there's one very direct way to increase hair growth and maintain the hair that you have on your head, and that's to increase IGF-1. That can be accomplished through prescription drugs such as growth hormone and things that stimulate the release of growth hormone.
Yeah, I'm going to have to disagree with Dr. Huberman here, because if you go back to our video that's called Can Steroids Cause Hair Loss?, you'll see that many supplements have growth hormone contained within them. The growth hormone can actually increase IGF-1, and then the IGF-1 will actually increase DHT levels. So by doing that, you actually can get more hair loss. So finasteride is even more important in a patient who's on all those things compared to someone who's not.
And they increase hair growth. They can increase turnover of skin. They can make skin look more youthful. All these things sound wonderful. That said, a number of people are using sermorelin as an indirect way to increase IGF-1 and thereby to increase hair growth. It does seem to be fairly effective in doing that.
This is running counter to what I've experienced in the literature. But keep in mind that there is conflicting data related to the effects of IGF-1 on hair growth.
The other thing about stimulating the natural production of IGF-1 is that, as its name suggests, insulin growth factor 1, you want to avoid being insulin resistant, because being insulin resistant and being obese can indeed lead to hair loss. There are a few supplements, so these are over-the-counter supplements such as myo-inositol, taken at dosages of about 900 milligrams before sleep, which, by the way, can also assist in sleep, or things like berberine or metformin, which are known to improve insulin sensitivity. Each and every one of these has its own profile profile of positive and negative effects.
But remember that if you are overweight and you lose a significant amount of weight, that too can trigger hair loss. That is a lot of stress on the body, and we know that rapid weight loss is associated with hair loss as well.
It's also known that when taken at about 300 milligrams of saw palmetto per day, divided into 2 or 3 doses, that's going to very likely help you hold on to some of the hair that you would have otherwise lost.
Saw palmetto does have some 5-alpha reductase inhibition of activity, and this is why we put saw palmetto into the formulations for the shampoo, conditioner, and thickening foam that I mentioned earlier.
Another commonly discussed and used commercial compound for offsetting hair loss and stimulating hair growth is ketoconazole. Sometimes this is known as Nizoral, where Nizoral is the brand name of a shampoo. So ketoconazole has been shown to be effective in increasing hair number. It's also been shown to be effective in increasing hair diameter.
Ketoconazole is both antifungal and anti-inflammatory, and that's why it's thought to help with promoting some degree of hair gain.
The major player in this whole story to maintain or increase hair growth is going to be finasteride and its close cousin dutasteride.
Last but not least,
it can increase hair count by as much as 20%. Finasteride treatment, done properly, can reduce hair loss in 90% of all people that take it.
I would say that the 90% is more for men. In women, the effects are less dramatic.
20 to 30% overall. Also should point out that finasteride comes in 2 major forms. There's an oral form and there's a topical form. Topical finasteride is typically taken in 1% solution or ointment and rubbed into the head.
Many places offer a smaller concentration of like 0.3% as well,
that people rub into their head, and it is thought that the 1% solutions are equivalent to 1 milligram of systemic finasteride.
Yeah, there definitely is not enough data to support that. I always think of the oral form of 1 milligram as being the standard form, the pill form. The 1% topical is not going to have the same bioavailability as the oral formulation. So I don't think that they're equivalent. I don't think we have enough data to support that claim. So I still put people on 1 milligram oral form to start. And if they experience side effects, then we down titrate the oral formulation to usually 0.5 milligram every 2 to 3 days. And if that still gives them side effects, then we might propose a topical formulation.
0.5 milligrams to 1 milligram of finasteride as a tablet per day seems to be an effective and pretty safe starting place for most people.
Exactly.
Thereby, taken for a long enough period of time, should offset hair loss and stimulate hair growth.
The effect on stimulating hair growth is usually not as impressive, but it definitely works to prevent further hair loss.
Get a prescription. I would hope that you're monitoring your DHT levels and other hormone levels. That would be ideal.
And you can get that prescription at feelconfident.com for a very reasonable price. Thanks, Dr. Huberman, for raising awareness for hair loss. And make sure to subscribe, and I'll see you in the next video.